The OCTA Research Group believes that the country should also be studying and be open to the idea of removing the face mask requirement in schools. Citing a study conducted by CNN medical analyst Dr. Lena Wen, OCTA fellow Father Nic Austriaco says that the wearing of face masks has affected the social development of children. This supposedly is evident in their language development, social interaction, and extracurricular activities.
Our children have suffered for 2 years. They did not be nearly one of the longest in the whole world of a lockdown without school. We must move from mask to real face-to-face for our children. And since the data shows that masking is not as effective, we should be willing to move there as soon as possible.
However, the health department maintains that the wearing of face masks is still important to children, especially now that they are back in classrooms. Based on data, only about 43% of children from ages 5 to 11 are fully vaccinated.
Masking is protecting our children. Pag tinignan po natin ang atin pong mga kabataan, sila po ay pumapasok na ngayon sa eskwelahan. So there is more interaction, there is more mobility.
Here to give us her take on the possible easing of the mask mandate in schools, we have with us pediatric infectious disease expert Dr. Ong-Lim. Good evening. Welcome to The Big Story, Dr. Ong-Lim.
Evening, Robbie.
Ma'am, your take on this discussion?
Evidence has actually shown that masks are protective when we talk about transmission within enclosed spaces and in areas where physical distancing cannot be implemented. In countries that have continued to hold face-to-face classes, even during the peak of the pandemic, there has been data showing us that schools that have continued to implement masking guidelines and mandates have shown lower numbers of cases of in-school transmission. So for the meantime, where we have so many changes going on in a setting where cases are still yet to plateau, and we have still quite some way to go with respect to vaccination. I think we don't lose anything by maintaining the masks for our kids, particularly when they go back to school.
Yes, the concern for infections and also the benefits and the efficacy of masks, that clearly has been established. But is it a valid concern at the very least when this research takes a look at it, not necessarily purely from the perspective of infection, but from the perspective as well of child development?
Well, of course, we know that a lot of our communication takes its cues from nonverbal language, facial expression, even looking at the way we express our words. But again, as in many of the interventions that we implemented to try to control the pandemic, it's a question of balancing the risks and benefits. So siguro dahil nabanggit nga kanina dun sa simula ng programa, na ang tagal na nga na hindi pa natin pinapasok ang mga bata sa eskwelahan. Ngayon pa lang tayo babalik sa face-to-face classes. Implementing all of these variables all at the same time will really make it very difficult for us to assess where to intervene should there be clustering of cases. So siguro, from the pediatric infectious disease perspective, I don't think we lose anything by being cautious, especially since we are just implementing the return to classes.
Right. Dr. Ong-Lim, we have just gotten back to face-to-face classes. For some kids, it's 3 months. For some, almost a month. Do you have any data from on the ground on how many infections or if are there transmissions in schools? Are there numbers kahit from a few case studies lang or certain regions or certain localities?
Well, right now, we don't really have anything solid coming from the schools. But I can cite, as I mentioned earlier, data coming from other settings which have continued face-to-face classes, and in the context of continuing community transmission. If you're following the news from abroad, they're actually again looking at re-implementing masking in school settings. So medyo kung sila tinitignan nila yung pagbabalik ng mask, tapos tayo naman nag-iisip tayong magtanggal, hindi nga ba magkasalungat yun? Nakita na nga nila, nanggaling na sila doon, di ba, sa setting na wala silang mask, and yet they're thinking about requiring masks in school, especially if there's a high level of community transmission.
What about vaccinations, Doc? Vaccinations in school, this has been brought up a number of times before the opening of classes this year. Is there any chance na magpapatuloy ito or that we'll see it happening, at least having vax sites in schools?
I did hear from the Department of Education team that they're looking at this, in conjunction with the Department of Health. And this can be very much aligned with the settings-based program that the DOH is now pushing as part of the booster campaign. So sana magkaroon nga ng opportunity to have that in place, because we also know that some people have difficulty accessing their primary and booster series, and locating these vaccination sites in schools will certainly be very convenient.
Right, maraming salamat. Thank you for joining us tonight and sharing your time with us. Pediatric infectious diseases expert Dr. Ong-Lim. Thank you, Doc.